to the Oral Health Podcast. So today we're joined with Dr. Millie, who is here on behalf of Align Technology. As we're talking about technology this week for National Smile Month, she is here to talk about the technology that goes into aligner treatment and clear aligners and just how far orthodontic technology has advanced in recent years. So I hope that you enjoy this episode. It was definitely an eye-opening experience for me, and I hope that you learn a lot. Thank you to Align Technology for sponsoring this episode of the Oral Health Podcast. Okay, so Dr. Millie, it's amazing to have you with us. Do you want to just take a second to introduce yourself?
Yeah, absolutely. Thank you. So my name is Dr. Millie and I'm a general dentist. So I work in London in a few practices going around doing Invisalign. And I have been using Invisalign now since 2016. And really it has become what I spend most of my time doing. So when I started using it, I really fell in love with what clear aligners and what the treatment can offer patients, and also sort of being able to create that work-life balance for me as well. And now that's really what I do. So it's been a bit of a journey, but loving every second of it and keeping the journey going further forward in the future.
Brilliant. Okay, so if anyone doesn't know, what exactly is Invisalign treatment? What does it entail?
So Invisalign or clear aligners is an orthodontic appliance, and it is an alternative to the more traditional fixed braces. And so it's an appliance, and you normally don't get just one, you normally get a series. So you might have 12 or 15 or 20 or 50 stages of clear aligners. So you get them in little packets and you move on from week by week. And what that means is that the teeth are moved in small increments from where you are now to where you've decided, and your doctor or dentist has decided you want that final position to be. So it gently moves the teeth. And really, it's an incredible technology to be able to do that with, when you think about it, little bits of plastic to get the teeth straight.
Yeah, absolutely. I mean, I had braces when I was younger, and they were like the traditional metal train track braces. I'm sure, awkward 12-year-old Sophie would have loved something like Invisalign because it is so much less in your face.
Yeah, absolutely. I mean, I feel like everyone sort of, or lots of people go through this phase when they're younger where they do want braces. I mean, I said I wanted braces and glasses at the same time. The optician wouldn't give me glasses, and then I kind of got a little bit too much when I had my braces, because I actually had a skeletal discrepancy, so where my jaws were the wrong size, and so I was put into a head brace. So I had this really stunning yellow, red and green, or red, blue and green, no, red, blue and green strap that went around the back of my head to try and stop the forward growth of the top of my jaw. So as a 12-year-old girl in an all-girls school, that was not quite what I had in mind, but I also had the train tracks as well.
Oh wow, yeah. Well, sounds very stylish.
It wasn't the best look, I have to say, but it did do its job. So,
That's the main thing.
it, exactly. And it stopped me needing something, more invasive like surgery.
Mhm. So in your practice then, when you're seeing patients, are you seeing them want things like Invisalign more than, compared to a few years ago? Because as we've just, discussed, technology's moved on a lot when it comes to orthodontics. Is Invisalign more sought after?
So I think, yes, I would say so. So I believe there's been an increase in all sorts of aesthetic dental treatments. We definitely saw a big boom after lockdown when people could see themselves talking on Zoom and other sort of online video platforms. And people are becoming more aware of the options, I would say, that are available to them through things like social media, in the news, in magazines. Actually, there's a lot more talk about what's on offer, and patients are better educated, which is fantastic. So they are more empowered now to make decisions that are right for them. And in terms of clear aligners, because they are nearly invisible, and I never say they are truly invisible, because patients, like when they're wearing them, they'll look in the mirror and they can see them, because obviously it's your own face. But most people can't really tell you're wearing them, and they definitely don't stand out straight away. Now, I always say that people who are wearing Invisalign have worn Invisalign, or dentists, we can always tell, because we're more attuned to what they look like. So when you're wearing Invisalign, it's almost like when you have one car, you see your car all over the place. And I think more people are having it, and it's becoming more of more of an acceptable treatment, I would say. So people aren't like trying to hide it as much as perhaps they would have been previously, because it's become more of a social norm. Everyone, you just pop out your aligners.
So when you're in clinic and you're using things like Invisalign, how exactly is it different to traditional braces? So say, like, I'm not a dentist, I don't have any prior understanding, if you like, of how it all works.
So for all patients, what I do is I do a standard assessment, because I'm looking to make sure that whichever treatment modality we use is appropriate. And sometimes we need to do work first before people are suitable to have orthodontic treatment, whether that's fixed or clear aligners. And I think for me, I try to always do I try to do an assessment that would give us the opportunity to see what options there are, rather than doing an assessment that leads someone down a very particular pathway. Because actually, I would say my role as a dentist, yes, is to look after people's teeth, but it's also to look after people. And I need to make sure that I can offer and look at the different options available and talk to the patient about the pros and cons of each option, and which is going to be the most suitable one for them, or the most effective one for them. So I do facially driven treatment planning, and so I look at the face, the joints, the teeth, and I look at all the health stuff. So everyone that comes to see me actually gets a checkup at the same time. And then I'm looking, at the orthodontic assessment, seeing where the teeth are, how they need to move. Is it going to be relatively straightforward? Are there complexities? Are the teeth worn away? So sometimes when the teeth are crowded, the teeth can wear. And so therefore, is it going to be enough just to do orthodontic movement, or do we need to be doing some restorative at the end as well, to get the teeth into the right shape? Because whilst teeth can be moved, they're not going to miraculously change shape with Invisalign or traditional braces. And there is and then looking at the type of tooth movements, and is it going to be suitable for clear aligners, and what we need to achieve for the patient. Now, I would say that I used to do fixed appliances first before I did clear aligners, and now I can do everything that I would be happy to take on with fixed, I can do with clear aligners. That's not always the case for everyone. So some people feel more comfortable doing some cases with fixed and some cases with clear aligners, which is completely fine. I guess it depends. And conversely, people will feel more comfortable with some fixed appliances for cases than I would. So it also depends really on your dentist experience and what cases they've done, what training they've done, and where they feel their competency lies. So when you're looking for a dentist who's going to carry out the treatment, that's an important aspect to consider as well. So I actually tend to see a lot of patients who've been told they can't have clear aligners, but when we break down the case, actually we can normally get what they want. It just is going to take a little bit longer, or we need to think carefully about how we're going to plan that. And so I have those conversations at the start with the patient, of course, to make sure that they're fully informed with what option they're going to go ahead with.
So then, is there any situations where it's just not possible to use clear aligners for a patient? Because, like you say, someone could have seen a dentist previously and they've said absolutely not, but then, you can sit with them a little bit more and go, oh, okay, yes, we can, but first we need to do X, Y, Z. Or is there any situations where it's just not practical?
So there are movements which are more predictable with fixed appliances compared to clear aligners, and there are some movements which clear aligners are actually really good at compared to fixed appliances. So I think when you're doing that assessment and when you're looking at those movements, it's a balance. So if that movement's going to be more difficult with clear aligners, but we'll get there, it just might take a little bit longer, then I would say that that's still okay. If that movement's going to be really, really challenging and perhaps we're not going to get it, then I'll be speaking to the patient about their other options. Having said that, with the use of auxiliaries, and when I say auxiliaries, I mean extra things like little elastics. We can put little screws into the bone to help us. We can make those movements which are less predictable more predictable and get that end result. So again, it comes down to experience and really what you're bringing to the table as a patient in terms of your one of my mentors and my educators, so from the courses I've done, they said they don't come just with they come with dental baggage. Not everyone comes with a pristine set of teeth, so sometimes we have to work around that, especially if they've had implants in the past, or maybe they've got retained baby teeth that we need to be cautious about. And I think the beauty of clear aligners is actually that we can work around those quite easily, because we can program for no movement to be on those teeth, as the planning is done digitally on a sort of computer or web-based computer program, which is fantastic. And that really allows me to show the patient what their teeth will look like before we even start, and talk to them about what we need to do. So maybe when we need to use an extra auxiliary, so something a little bit more to get the movement in an efficient way, and show them, are you happy with this end result? Are we going to, this is why I move the teeth to this position. Does that make sense to you? And does that look like something that you want to do? And for patients, I find that it really helps them actually own their treatment a little bit more, because they can see the end result. And I want my patients to be part of the sort of treatment planning. So don't get me wrong, my job is obviously to do the treatment planning, but I don't want someone to feel that I'm doing something to them. I like it to be very much this team approach where we're doing something together, because I do my bit, which is the planning and getting the predictability. They've got to do their bit, which is wearing the aligners, and also giving me feedback as to whether that is what I was expecting, or maybe that isn't quite what I was expecting. Is it possible to tweak this or this? And then we can have a conversation about, yes, it is possible, or actually maybe that isn't possible in this particular case because of X, Y, and Z, and this is why. And I find that doing that, people it's just such a nice treatment. I mean, it's so nice to see what your teeth are going to look like before you start. You have that end goal.
Yeah, that's really interesting. I wish something like that existed when I had my braces treatments, because from what I remember, you just had your impressions done and they sort of said, yeah, this is kind of what it'll look like, but we don't know.
Yeah.
And it's actually really cool to know that there is a way to say, this is exactly what your teeth are going to look like.
Yeah.
That's amazing.
I should put exactly in inverted commas, just in case with the less predictable movement.
Yeah, obviously you've got to account for discrepancies and things like that, but still.
Yeah, and it's getting better and better, because now we can show people in their own face. So we've got in-face visualization. So we take a photo of the patient's face and we can superimpose a ClinCheck into the patient's faces. Before, it was just sort of floating teeth, and now we can see it inside the patient's, actual smile. So that's AI technology. And I mean, it's so cool. Like previously, clear aligners, before, going back decades, you'd take the model, and then you'd sort of almost cut the teeth, reposition the teeth, and then reposition the tooth, and you'd be creating the aligners like that. So it was a very manual process. And then really, when with the development of the ClinCheck and the software, actually that now is all done digitally. And I think that's really where that huge step forward in terms of availability of the product and usability of the product has made a big difference, and has now become more widespread because of that.
Yeah, that sounds really cool. Another piece of technology that Align use is these big fancy iTero scanners that you guys use in your treatment plans. As I said, I'm a non-dentist. They seem like absolute wizardry to me, but can you just explain exactly what those are, how they're different to just a regular scan?
Traditionally we would take molds of the patients of people's mouths, and I mean, you've had braces. We can all agree it's not that pleasant. There's a lot of goop going on. And so what the scanners do, what the iTero scanner does, it takes a 3D image of the teeth. So actually you don't have to do all that goopy stuff. It creates that model for us, and it creates that model digitally for us. And by doing that, one, we have the model, but also it creates all this data for us. So one, we can keep scans from the patient's checkups for our general patients, and see if there's any changes in a way that actually is far more accurate than our eyes can. So here I'm thinking about gum recession, so where the gums move down the roots of the teeth rather than staying where they are. And there's a few different reasons for that, but we can see how that's progressing over the years. If we think about teeth that are wearing, so where you've got some tooth wear, we can scan and we can compare them and see how quickly that's wearing. And that's really empowering for people to see, because a lot of the time the changes are so subtle that actually you don't notice, and then 10 years down the line you're like, oh my gosh, my teeth have really worn, or they're really, and you think it's happened in the last 2 years, but actually it's been happening over time. Most of the time, not all the time. And it's a great communication tool. I mean, when I use it, patients are like blown away by the fact that they can see their teeth. And I mean, we all know that dentists probably aren't people's favorite place to be, or people to be sat in the chair. It's very personal, and a lot of people don't like it. And I really do understand. And hopefully, at the moment the profession's really changing, and we're trying to move past that and create a better experience for people. But one of the things that, obviously, when you perhaps don't like the dentist so much, there's this trust element. And when I say, oh yeah, you've got a hole in your tooth, or you've got a crack in your tooth, you kind of have to just take someone's word at it, and then you do the treatment. Whereas now, if I can show you the hole in the tooth, if I can show you the crack in the tooth, actually what this means is that that barrier is taken down, because seeing is believing, right? When you can see something, you're like, oh yeah, no, I can see that, right? That makes sense. And I think I certainly, when I first started, I probably, because we see teeth all the time, we're really obsessed with teeth because we're dentists. For us, when we say, oh, there's a hole, there's a crack, it makes complete sense in our mind. But actually, when you're trying to communicate that with someone without having a visual aid, is more of a challenge. So for me, I use a scanner for everyone, and we scan all the patients, and we really try and keep that record and that communication channel open.
I think you're absolutely right. I know people now definitely are getting more accustomed to digital information, and as digital technology changes and all of that good stuff. But I know if someone used that on me and just was able to show me this is exactly the problem, I would be able to say, oh yeah, you're right. As someone that doesn't have any clinical experience, that's something I think is actually really valuable.
Yeah, exactly. And it's like when like sometimes for Invisalign, I get people who come in who want Invisalign and they say, oh, it's just this one tooth that I don't like. And I really understand, because that's the tooth they see that they don't like. But actually, it's not just that tooth we need to move. We normally need to move all the teeth in order to correct that tooth position. And also thinking about what's going on in the other arch. So you've got the top arch and the bottom arch. So what's going on in the other one? Like, is that helping creating the problem? Is that going to be an issue? And actually using the scan and then being able to manipulate it and show it in different views means that patients can see what we're talking about, because a lot of the time otherwise it's just sort of conceptual, and it becomes very conceptual, and that I think is a barrier. I certainly like to understand things before I go ahead. Like at the moment we're about to lay some new lawn, and I mean, when I'm talking to lawn companies, I was like, I really had to research it so that I could talk to them in a way that I would then understand exactly what they're going to do. If they just sent me a whole list of terminology, I would feel overwhelmed and would be like, I've got no idea what you're talking about, but okay. But now, because I've done the research and I understand it, and they've spent time talking to me about all the different processes with images and diagrams, now I'm like, okay, no, I really get it. So it's not just for dental life, it's for about all types of life. We like that visual communication.
Yeah, absolutely. Now we can't really talk about clear aligners without talking about the elephant in the room of direct consumer orthodontic treatments, or in other words, companies that will sell you aligners without you ever having to go and speak to a dental professional. Now, we won't go too much into this because it is huge topic, but I just really would like to get your thoughts on how something like Align technology and Invisalign is different to, for example, these companies who I will not name.
So I think for me, I know how much time and effort goes into creating the right ClinCheck. And when I say ClinCheck, that's the online planning service, and making sure that the ClinCheck is right for the patient. And that takes me a long time. And the more time I spend on it, as long as the patient wears their aligners, the less time the patient's in treatment. And we do thorough assessments, and I do my own ClinChecks, but I also help, and I help out with the Invisalign education, and so I see a lot of ClinChecks each week, and the care and time that it goes into the planning process is significant. And when we think about all the research and development that has gone into sort of making movements more predictable, that Align have done, I think it's something like 1.3 billion over the last 9 years has gone into the research and development of Invisalign. So it's a significant amount of money. It's a significant amount of research that's going in, and each year they're bringing out new clinical innovations to really ensure that it's the user interface. We're getting that predictability in the movements, all the attachments, how things are staged, everything. When I think about what that really derives from, it really derives from very good assessment of the patient. And for me, I like to be, there's some things I can see on photos, sure, but actually there's a lot of things I really need to have seen for myself in the patient's mouth, to be happy to comment on or talk about. And that for me is a big difference. I think there are some companies who perhaps don't use attachments, or perhaps don't plan in any sort of little bit of microfiling. And my worry there is that actually what that means is that we are going to be relying on a particular type of movement, which is more predictable, which is where we move the teeth out, which we call proclination. It just means tipping the teeth forward. And making sure that's within a particular person's biological limit, and what I mean by that is within the bone, is important, because otherwise we can be left with recession, we can be left with unfavorable bites. And I've seen a few cases that have come to me after having treatment, and we've either had to go back into treatment or with Invisalign and try and move things a different way, and also maybe doing some other treatment like restorative, so veneers, composites, etc., to try and get things back into a comfortable bite. So that would be my main concern, I guess, is just making sure that everything's safe, because sure, we can move teeth, but is it that right plan for the patient? And making sure that everything's been considered, and if there are more complex tooth movements like rotations or intrusions, so when we're rotating tooth, we're twisting it round. When we say intrusion, we're moving the tooth sort of vertically to correct sort of a vertical discrepancy. Normally we're doing that to correct a bite, to make the teeth that smile look more even. Those movements are more challenging, and they do normally require some auxiliaries such as attachments around on the teeth to make them more predictable, to make sure that they actually happen.
Yeah, and at the foundation we hear a lot, and one thing I will say is that these companies tend to stick to a one size fits all attitude to their treatments, and that is just the exact opposite attitude you need to have with anything related to healthcare, dentistry or not. But we'll leave that conversation for a different day. Let's finish on a bit of a lighter note.
Yeah.
So we've talked a lot about technology that is happening now. But technology always changes. What is the one thing in the future, your golden nugget of tech, that you just think is going to be game changing if it comes out?
I mean, I was actually talking to someone on Tuesday night, and I was like, I feel so privileged to be a dentist in this at the moment, because things are developing so quickly. I mean, it's astounding. Like, even when I first started Invisalign to where Invisalign is now, it's crazy. And obviously I've gone on my own learning journey at the same time, so I also know how to use it better and everything. But I feel that the future is going to become more digital. So we're really digital now, but becoming more digital. I think there's going to be far more AI technology introduced, which is fantastic, because again, it's just breaking down those barriers. I mean, I'm waiting for the day where, I'm like in another room, and it's like, the cardiac surgeons, what they've got at the moment. So we're in another room. So people don't need to be scared of the dentist anymore, because the dentist isn't even in the room. I don't think that's coming very soon. But, just even more minimally invasive things. I mean, our materials, everything's getting better and better. I think orthodontic treatments probably will become shorter. Of course, we always have to consider that the technology can improve massively, but human biology isn't going to, go through a 10-year evolution that quickly. But the main thing I would love to see is, I would just really like to see a better relationship between patients and the profession. I think that we're in a position where, with the technology we have now and the technology that I hope is coming, that we can really improve the lives of our patients. And I think that there is you see it in the media and everything, there is this breakdown of some parts. And if we can all strive to work together and be understanding as a whole, that's the patients and dentists, and really work to communicate and as I said, have that relationship together, then I think that's where I would really love the focus to be over the next few years, because I think that's really important. And once we create that, then everyone's going to benefit, because people will have less issues, better oral health, pain problems. And we all know those pain and problems start on Christmas Eve, or when your dentist has just gone on holiday, or when you're just about to go on holiday. And actually, if we can work for that then I think that that's truly going to uplift everyone. We don't just look, I really don't believe that dentists look after teeth. We look after people, and we have to understand everyone is different, and talk to people in change our approach. Just as you said, it's not a one size fits all model. And I just really am excited.
Oh, that's amazing. And you are right. The human mouth can only evolve so much before we hit the cap on what technology is able to do for us in that sense. But it's been really, really lovely to speak to you. And, I'm going to let you get back to your very busy day and enjoying your new lawn. And yeah, thank you so much for sitting down and talking to me.
Thank you so much. Have a lovely, lovely day. It's been an absolute pleasure. And yes, enjoy the sunshine too.
There you have it. That was our conversation with Dr. Millie, all about the technology that goes into Invisalign and the things that Align Technology are up to. Now, if you want to learn more about them, I'll link a bit of information in the description of this podcast. Thank you again, Dr. Millie, and I hope that you enjoy what's left of National Smile Month.